Welcome to your program, Healthy Conversations. My name is Pastor Philip Gai, and I am your host for this program. In this program, we talk about health, nothing else but matters health. We just want to bring you to speed on some of these diseases that you may be aware of, or you may just need a little more information so that you know the right decisions to make for yourself and for your family going forward. And today, we have our guest in studio. This is none other than Dr. Danny Hong. Dr. Danny Hong, you're most welcome.
Thank you for the welcome.
Dr. Danny Hong is a consultant physician with many years of experience. He is particularly skilled as an IM, internal medicine, and he has dealt with some of these diseases that we are talking about for a long period of time. And today, our focus is on this very important disease, diabetes. I hope you are going to enjoy as we discuss. You're going to learn something. You're going to grow as we talk about diabetes. Why is it important to talk about diabetes, Dr. Hong?
So diabetes is a very important topic because it's such a common illness. Not only is it common affecting many people, but the consequences are so severe, leading to severe disability and death. So that's why it's such an important topic that we need to address today.
Why is it that diabetes always leads to some of these advanced consequences like, limbs being cut off, even death? Why is it so severe like that?
Unfortunately, there's not prompt recognition. So patients may go with high sugars undetected, or they're not being managed appropriately. So they're not keen on taking their medicines or making those necessary lifestyle changes that prevent the sugars from cascading out of control.
So today we want to discuss a little bit details about this diabetes. How would you describe it? How would you describe this diabetes as a disease?
So the word diabetes, or the full name diabetes mellitus, which is from Latin, diabetes means to pass through, and mellitus or mellitus is sweet. So it's assumed that the passing of the urine or the short call is very, very sweet. And that occurs because when the sugar in the blood is so high, then the body's not able to control the excretion of the water inside the urine, so the sugar passes through there. And so it makes the urine sweet, or it makes the urine sugary. So that's why it's called diabetes.
So what are we supposed to do when we are reversing diabetes? Are we trying to make the urine bitter or not sweet?
No, so we want to control the amount of sugar in our blood. So if there's excess sugar in the blood, then that's also leading to damage, and that's leaking of the sugars.
Thank you so much. So Dr. Hong, in this first session, we just want to focus on what is the cause of this excess sugar in the blood? What are the factors that lead to my body having just some excess sugar in the blood as it's not supposed to be?
So in order for us to know why our body is sick when the sugar is high, we should know the normal physiologic function. So we should know the normal way. So all sugar is in all food. So even the most bitterest vegetable, whether it's a deck, something that has some small semblance of a sugar inside there, when it comes into our body and we absorb it. So when the foods come into our mouth and when it goes to our stomach, our body breaks it down to small pieces, and then some of it's recognized as sugar. And the food will ultimately increase the sugar level inside the blood. When the body recognizes that the blood sugar is higher, then it secretes the hormone called insulin, which helps to reduce that blood sugar. Yes. So if you have not enough insulin, or if the amount of insulin secreted is not enough to decrease the amount of sugar, or if you're not secreting it at all, then it leads to diabetes.
So where is the problem? Is the problem the sugar coming in excess, or the insulin being insufficient to clean up this sugar?
It's yes and yes. So both is the problem. When we overtake too much sugar that overwhelms the amount of the body to secrete enough insulin, or if the body is used to a certain amount of sugar in the level and then we exceed that amount, the insulin that's secreted is becoming resistant, which means that it's no longer as effective as it was when it used to be. So with that, the body needs to secrete more and more to meet up with demands of the diet.
Okay. So when I have diabetes, how do I feel as a patient when I go to the doctor and I explain myself and the doctor listens to me? How do you know that I have diabetes? Does it have to go through some test, or just by observation and by looking at some of the symptoms, the doctor is able to tell that you have diabetes?
Well, hundreds of years ago, diabetes, as I said, it means passing of sweet urine. They used to actually have to taste the urine to see if this
Actually leak it?
Yes.
That's crazy.
But thankfully we don't do that anymore. Now we have modern technology where we can see the amount of sugar inside the urine. So they can do the urine testing. They can also more accurately check the finger where they check the amount of sugar inside of the blood. So that's a pretty accurate way of testing what is my sugar right now at this moment in time of the sugar in my blood right now.
So then how do I feel if the sugar in my body is excess? Do I feel some symptoms within me? Are there some physiological functions in my body that reacts and they're able to tell that the sugar levels are not in their normal position?
So we have some cardinal or some primary symptoms of diabetes, and that includes frequent passing of short call. So we call that polyuria, which means lots and lots of short call passing. You may go frequently. Some people say, I've been going every 10, 15 minutes. So that's a common symptom. Another is that you feel increased thirst. As you're passing the sugar, you're also losing water. And when you're losing water, you're becoming dehydrated. So a lot of the times when the sugar is high, the body is dehydrated. So you feel like you have an urge of thirst. So they're drinking and drinking. And the other thing is that they're feeling increased appetite, and they're having to eat and eat to make up for that, the sugar loss, the water loss. So they're increasing in their appetite.
So let me ask you, these symptoms that you have talked about, do they automatically mean that when someone has them, they do have diabetes, or they could be symptoms of other things? Like if I have to pass urine after every 10 minutes or after every 15 minutes, does that mean that I would automatically be tested and I have diabetes? Or it could also be something else?
It could be something else. And many of these diseases, the symptoms that you may experience are not specific for that one disease. So what we typically do is we screen people. Because it's such a common illness, and also because it has severe consequences, we screen our patients, especially if they have risk factors. As we mentioned in our previous episode, that high blood pressure is also a risk factor. In patients who have high blood pressure, if they are obese, and if they have poor lifestyle habits and dietary choices, we should screen them on a routinely basis.
So what is involved in the screening of diabetes? Does it involve intrusive pricking and pain and pressure? What comes with this screening of diabetes?
So diabetes, how it's detected is we check the amount of sugar in the blood. The best way to detect it is on a fasting stomach. The reason why is because right after a meal, the sugar is expected to be elevated. So we cannot really reliably say that a patient is diabetic because the normal response, yes, the normal response after a meal is a high sugar. So the best way is to check the fasting blood glucose or the fasting blood sugar. So we take it usually in the morning after they had a long period fast, yes.
Before they eat anything?
Yes, before their morning breakfast. We check it. And anybody who is above 7 with a fasting level is diagnosed with diabetes.
Above 7
yes.
on the testing scale?
On the strip, yes. And another test is called the hemoglobin A1C, that's sometimes also used. So one test is a prick of the finger, and the other test is where they draw it through a vein. And that test tells us how the sugar has been elevated over a period of 3 months. So that's an indication of chronic sugar measurements. And that's a little bit more reliable because as sugar changes from day to day to day, the blood test for a chronic test can tell us what is the average sugar in the blood for the last 3 months.
For the 3 months?
Yes.
Okay, so this is more reliable than the prick, but this also works equally well?
Yes, this is more cost-effective and friendly. So these ones may be free. A lot of health centers do it for free or at a very small nominal fee, whereas the other tests may be a bit more expensive and hard to obtain.
I've had some situations where they say that the machine can be given for free or even at a minimal cost, but you have to keep on refilling some testing sticks or gadgets, and that might be expensive for some of the patients. What would you say about that, Doc?
That's true. So the machine itself just requires a battery, and a lot of companies give the machine for free because they know that you're going to be purchasing the consumables on a routine basis. So the machine comes with a strip. The strip is where we put the blood, and then the packet also includes a pricker. So it's a small little needle that you use to prick the finger, so you can use that blood to transmit it onto the strip, which is read by the machine. So those strips are usually what's pretty expensive. But I would say that it's a worthwhile investment for people to have if they have diabetes. Yes, if you don't have the disease, you don't need to invest in a machine. But if you have this disease, it's something that you need to be vigilant about and recording the sugars.
Because you'll need to be checking from time to time.
Yes, yes.
Now, with these tests, whether it's the pre-con, the other one you said is called H what?
It's called the hemoglobin A1C, which is the average amount of sugar in the blood cells.
Is there any chance of possible misdiagnosis? I've had cases of people being treated for diseases that they did not have.
Sure.
Well,
So there are cases where the sugars can be elevated not due to diabetes. For example, some drugs that we take, some steroids, medicines that we take, some antibiotics, some drugs may elevate the sugars for a bit, but that doesn't make them a diabetic. So in those cases, we would really want to check and routine follow-up. So if they have it for an extended period of time, we can say that this is a chronic illness, that they have diabetes.
Doc, you said that when the level goes to 7, then this person is described as being diabetic.
Yes.
Is there a low bottom level? And if it drops below that, then it would also be maybe not good.
Yes, so low blood sugar is also very dangerous, but that was not normally seen in people who are not taking drugs. Usually we only see very low sugars in people who are diabetic, and maybe they forgot to eat after taking these drugs and it brought their sugars down, or they overdose on the medicine. So those are the cases where the sugars will become low. But in non-diabetics, it's very rare to get any low blood sugars.
And so when they get to those low levels, there would be remedies for that.
Yes, so the best remedy is that we give them something sugary to drink to boost that sugar up. We want to make sure that it doesn't become so low. So we give them like a banana or some fruit to help bring that up.
Okay, I want to take you back on the risk factors that you mentioned, whether it's obesity, whether it's issues of lifestyle. Can you bring us to speed on a little more of this so that we can understand what to avoid as we come to these issues of diabetes?
Yes. So diabetes is a disease largely related to lifestyle. And we've done studies on this historically, where in America, we used to have the Native Americans, which were the people that were indigenous who were living there before. And they didn't have any incidence of diabetes until the Western influence moved there. And after they had adopted a different way of eating, there was now refined foods and there was now fat foods. They not only changed in the way that their body was, but they also changed in their disease states. So people, you have the same type of people who now had transmitted a different type of lifestyle, and now they have developed the disease. Similarly, in immigrants, we see people who are native to their country, they don't have that risk factor or they don't have the disease, but after they've immigrated to a Western culture, they've developed that disease from the poor lifestyle.
Okay. Dear viewer, you're watching Healthy Conversations. This is a program that brings us to speed on matters health so that we may understand the right choices to make in terms of lifestyle, in terms of decisions that we just have to do to ensure that we have optimum health, vibrant health, so that we are happy and healthy and living well. And in studio, we have Dr. Hong, who is an expert, consultant physician, who is helping us come to speed with some of these matters health. So stay tuned as we continue in this episode. Now, Dr. Hong, I've heard of this diabetes being talked about in different types. Type 1, type 2. What does all this mean?
Yes. So diabetes is categorized in type 1 and type 2 dependent diabetes. So type 1 diabetes means that the body that does not secrete or does not produce any insulin on its own, which is the hormone that's necessary to bring the sugars down. Insulin is made in a part of the organ called the pancreas, and this pancreas is right next to the stomach. And it's next to the stomach because the stomach is where the sugar is being intaken from the mouth and it's being broken down. So as the body absorbs things from the stomach and the intestines, then the pancreas is able to secrete insulin in response to that. So type 1 diabetics, they do not secrete insulin, which means that they must be dependent on insulin being administered from outside. So we give them the injections of insulin. Without insulin, then they would not be able to process the food, and the sugars would be high, and they would succumb to death.
So that's type 1.
That's type 1.
At what point do you know that this person's body does not produce insulin? Is it at childhood or at a middle age or at an adult age in life?
So type 1 diabetics usually present in their adolescent years, anywhere from 12 to 18 years. So that's when we can say that this is an autoimmune disease. And it's not typically mediated by a lifestyle effect because it's your immune system that's attacking the pancreas, which is preventing them from secreting the insulin.
So does this mean that this person will have to inject insulin in their bodies for the rest of their lives?
Yes, unfortunately, it's somebody who's dependent on that for their survival for the rest of their life.
So that's type 1 diabetes.
Yes, yes.
Is there any cure for that, or they just have to manage their life with insulin and there's no cure?
So there is no permanent cure, but there are many, many advances in technology. For type 1 diabetics, instead of injecting themselves, now they have a self-injector where they have a machine that they just wear at the belt, and that machine can now test their blood and simultaneously give them the medicine without them thinking about it.
That's amazing.
Yes, yes.
So the machine would just be put somewhere near their stomach?
Yes, yes. It'd be put near there, and then it would inject directly into the fat whenever it would need to. There's a timer on there. It tells you when they're eating, and it can measure the blood at different levels.
And if it's not needed, it would not inject?
Yes, yes.
How intrusive, how painful is that?
They don't feel anything.
They don't feel it?
Yes, because the injection for the sugar, or the insulin rather, is actually quite only in the fat cells. So you don't feel a lot. Yeah, it's not like the finger pricking where there's some more pain because the finger is more sensitive. But down here where the fat areas, there's not a lot of sensitivity there.
Is this information out there? Are people aware that they could just handle type 1 diabetes like that and live the full life length? Or many people don't know about this?
I think a lot of people are unaware. So we need to educate them and provide them with knowledge and empower them with these resources.
Okay, tell us about the type 2 diabetes.
Yes.
And maybe you could let us know which one is more prevalent than the other.
Yeah, so type 2 is most prevalent. In fact, since I've been in Kenya for the past 3 years, I've only had maybe less than 5 patients with type 1, whereas the vast majority of them are type 2.
And how many type 2 cases have you handled?
Thousands.
Wow.
Yeah, there are so many. So we have a diabetes clinic that we see every week, and we check their sugars and we follow up. So there's more and more people coming. We started off with a few, but as we were screening and as we were testing, we discovered that there's so many in the community that have not been receiving diabetic care.
So how many are you seeing like every week on average?
Every week in our logbook, we have around 50 patients.
And there are many other hospitals that are seeing many other cases with type 2.
Yes, yes.
Tell us more about this type 2 diabetes.
So type 2 diabetes develops when there's insulin resistance. And insulin resistance means that the amount of insulin that we need to decrease the sugars is not enough. So the body cannot keep up with the demands of our dietary eating. So as we get bigger and bigger in our weight and more bigger in our appetite, then we're overwhelming the amount of the body's ability to help decrease the amount of blood sugar. Yeah, so we have to take medications to force our pancreas to increase the amount of insulin they provide, or in addition to the insulin that our body is already secreting, we have to inject to supplement that as well.
Okay. Now, you're talking about these sugars that we have to control. Are there different types of sugars that are, superior to others? Are there better sugars, or are there, you talked about refined sugars. Tell us about these different types of sugars and their impact on diabetes, especially type 2.
So the sugar that people use when they talk is usually referring to sweet things. But as I mentioned, that regardless of whatever you eat, your body will eventually break it down to components. There's a fat, a protein, and a sugar. And the sugar that our body utilizes is called glucose. Yeah, so glucose is a foundational small structure that the body is using and incorporating to build energy and to use that to fuel our body. However, all food has different amounts of carbohydrates, which are larger structures of glucose. But when it goes into the body, eventually everything gets small and broken down into pieces, and our body absorbs it as glucose.
Okay, so are there bad types of glucose or good types of glucose, or some that you'd recommend, some that you'd not recommend?
So I would say that the source of where you get these sugars from is important, because where you receive it from, there can be a high quality carbohydrate or a low quality one. So we want carbohydrates of high quality to be found in whole grains and whole foods, which means that we want things that are with everything. For example, if you're eating like a grain, you want the entire grain, not just the inside small part where we remove the husk, we remove the bran, we remove everything outside. So we want a complex grain. That includes rice, that includes wheat, and we want to eat those things so that will help us maintain steady sugar instead of up and down rising. Because
when we're talking about this diabetes, let's say we are talking about the carbohydrates with the whole grain and all that stuff. Does the amount then matter? Or if I'm taking the right kind of food, the amount then won't matter as far as diabetes is concerned?
So you can actually eat more of a whole grain and your sugars will be less. The reason why is because whole grains have more fiber, which keeps you full for a longer period of time and doesn't allow your blood sugars to fluctuate as much. So when you're eating whole grains, you also feel very full. It's difficult to eat a whole pot of beans by yourself, isn't it? When there's a lot of beans and fiber and skin. But if you were to mash things up and if you were to find and take off all the husks, then you could probably ingest more. But that would be removing a lot of the benefits. So what we do is we counsel patients on eating whole grain foods to really control the sugar levels.
Okay. Tell me, you've seen thousands of patients, as you mentioned earlier. What is the impact of diabetes as a disease in families, in marriage, in the economic, socio-economic structures of our society?
It has a really crippling effect on all levels of society, on the individual level, the family level, the society level, community, and the national level, because it's so expensive. You know, for patients who cannot afford good access to good food, now they're also having to supplement to pay for medications, for follow-up, for the clinic visit, the laboratory tests, and all these tests are very expensive. They add up, yes, they're expensive. And not to deal with the consequences and also the complications of diabetes, as you mentioned, amputations. So these lead to disability that really impact negatively the mental health of the patient, being burdened down with this chronic illness, knowing that they cannot eat certain things, that they cannot do certain things, that, you know, their family is suffering because of them. It really, really burdens down on the individual patient.
Talking about amputations, I've had people with the diabetes, and this has always been a fear among many people, that once they have diabetes, they're going to have a part of their limb being amputated at one time or another. Is this an unavoidable thing, or it just has to lead to a situation where someone's limb has to be amputated?
It is avoidable and it is reversible. We can prevent it from getting to that extent. When you see people have blindness with amputations from a consequence of diabetes, it's because it's been untreated for long or it hasn't been managed for a while and they haven't made those changes to bring the sugars down. Yes, the consequences of diabetes, of staying with high sugar, is that the high sugar in the blood really damages a lot of the organs. High sugars can really damage the bleeding in the eyes, and it can lead to blindness. It can cause strokes. And because our vessels are very friable and tender, if they're damaged with high sugars, it can also lead to some chronic disease in a long period of time. Even the nerves that are affected next to the blood vessels, they're also damaged too. So it's something that affects every system in our body.
Is there an impact on the sexuality of the human body among diabetics?
Yes, a lot of men have erectile dysfunction, meaning that they're unable to sustain erections for a long period of time, or they're not able to, they have decreased amount of libido. So those issues are directly caused by diabetes because of poor flow in those areas.
What other impact would you say diabetes would have on a person's well-being?
I think it also greatly impacts their mental wellness. It may make them feel very stressed at times, knowing that they're sick. They may have to call sick off from their employers, and that leads to decreased productivity for the employer, and some of them suffer job losses because they're now missing many days, and once they lose their job, they don't have good health insurance, and that may spiral them down where they have issues of paying for the medications as well. And it burdens their whole family, knowing that this one sick person has to change everything, and now they're all catering for that person. It takes a very heavy toll.
Talking about mental wellness and diabetes, how is stress related to diabetes? I've heard people say that I didn't have diabetes until I got into this job, and it became so stressful that as a result of this job, I now acquired diabetes. How is stress related to diabetes, as it were?
So stress affects many diseases across the spectrum. When people are under a lot of stress, they don't particularly have good healthy habits. Let's say that they're under a lot of stress. They may not sleep as well, which contributes to diabetes. They may not eat very healthily or promote their physical activity, which also leads to obesity and diabetes. But in addition, chronic stress, as we mentioned in our previous episode on high blood pressure, it leads to sustained levels of this hormone called cortisol, and that also is pro-inflammatory, which can lead to diabetes as well. So all these these different structures and different concepts are related to each other. So bad lifestyle habits can lead to diabetes. The stress of a job can lead to both high blood pressure, which leads to diabetes, can also lead to diabetes independently too.
Now, Doc, you've touched on something which is very crucial here. How is sleep disorder then coming into diabetes?
Yes. So not getting enough sleep also is related to our hormones. As we mentioned, there's a stress hormone called cortisol, and not getting restorative sleep really impacts our metabolism for that next day. And for a long period of time, our body needs to recover. So sleep, the purpose of sleep is restorative and recovery, so that we can remove the stress from the previous day, from all the oxidative stress in the body, that we may be able to really process things and get us ready for the next day. But without that restorative and rejuvenative sleep, then we're not able to deal with the stresses that we have, and the stresses will accumulate over time. And I'm not just talking about work stress, but also physical stresses and also the health stresses that we have inside the body. And those things can really lead to diabetes as well.
You know, I'm looking at this disease, diabetes, and I remember growing up, it was one disease that was predominantly associated with the affluent, the rich. I remember even in our childhood times playing and joking that the rich people have a lot of money, and then there are some of these diseases and they're denied opportunity to eat the best foods. So you have diabetes, you're told you can't eat this, you can't eat this, you can't eat this, and you have all the money to eat all the things that you want. How is this connection with the affluence, this disease, diabetes?
So a lot of the animal fats that we take directly cause the diabetes. So any kind of animal protein, animal fat increases your risk for diabetes compared with somebody who doesn't intake that. So as you recall in Daniel, when Daniel and his friends were taken into captivity, they were offered to eat at the king's banquet, where there was some wine, some alcohol, where there was animal flesh meat, and where there was a food rich in refined products. So those things are directly related to diabetes. But as you recall, they chose to eat whole grains, they chose to eat pulses, they chose to eat cereals and different beans and different
and vegetables.
Yes, and so that really reduces the amount of risk of the diabetes. So I think likewise today, yes, we have people who can afford a lot of money for meat and a lot of flesh and a lot of refined products, but those are the people that are suffering those consequences.
When you talk about diabetes, is there a stage in life where you diagnose it and you say this is a stage where it's possible to reverse, and you diagnose this at this point in time and you say this is too late, there's nothing that can be done? Is there something like that?
I never believe it's too late for anybody. Even if you've had amputations and even if you're blind, there's never too late. Yes, your limbs may not grow back, but you can still prevent your other limbs from being amputated. You can prevent the other eye from being blind. So, you know, no matter how bad things are, they can still be worse, isn't it? So I always tell them that let's use this as a wake-up call. You know,
You
your
pick
leg
it up
has
from
been-
there.
Yes, please let's use. You've already lost one leg. Let's not lose the other. Let's please wake up and let's please change ourselves so that we don't deteriorate further.
You talked about these emotional aspects, or rather the social aspects of these human beings. When someone has acquired diabetes, are they able to live their life to the fullest, or does it mean that automatically the life is going to be cut short at a certain point in time?
So unfortunately, any diabetic is already, on average, 10 years at a lower life expectancy than a non-diabetic.
Any diabetic?
Yes, all diabetics are 10-year life expectancy lower. It's a major risk factor for a lower life expectancy from cardiac death or any death outcome.
So then what would we do to prolong this, or help this diabetic to live their life to the fullest, live a happy life, live a comfortable life? I guess when we come to the next part, we'll talk about the curatives and things like that.
Yes.
But all I'm asking is that, is there something we can do?
Yes. The good news is that type 2 diabetes is reversible. It can be cured. It can be reversed.
Completely?
As long as we're adherent to the good lifestyle practices, the diabetes will go away. But, as I said in earlier episodes, is that if we are not consistently maintaining a good lifestyle choice, the disease can always resurface and come back.
Do they also have this gadget which they can place somewhere in their body and it self-injects at a certain point in time and they don't feel any pain?
it's there, but the best way is to remove that gadget and remove any need for those things by fixing the disease and removing the disease itself.
And so we can look for better ways of fixing the disease and eliminating the disease altogether.
Yes, yeah. That's our goal, is that patients come off medicine, that they receive complete restorative health.
Thank you. Thank you so much, Dr. Danny Hong, bringing us to speed there on diabetes, and specifically here focusing also on diabetes type 2. And we've heard from the doctor it's possible to reverse, it's possible to eliminate. And in our next episode, we'll be talking about some of the finer details of what you need to know in order to keep away from diabetes and live your life to the fullest, live a happy life, live a hopeful life, trusting in God and moving forward hopefully. Thank you so much. I am your host, Pastor Philip Gai. This is Healthy Conversations. Looking forward to seeing you again in the next episode. Thank you so much.